Did you know that syphilis is one of the sexually transmitted infections that exhibit resistance to multiple antibiotics? In other words, there are a lot of antibiotics that used to treat syphilis before, but now they can't treat the same disease because of resistance. Today, KAREEM'S Clinic delves deeper into discussing syphilis, how it is transmitted, and how it is treated. What is syphilis? How is syphilis transmitted? How do we get syphilis? Now, syphilis is a bacterial infection which is spread by sexual contact. If you have a sexual intercourse with someone who has syphilis, or who has a pathogen or pathogens that cause syphilis, you will acquire that particular disease. This bacteria that causes syphilis is known as the Treponema pallidum. Treponema pallidum is the scientific name of a bacterium that causes syphilis. Treponema pallidum is a gram-negative bacteria. What does gram-negative mean and what does gram-positive mean? Gram-negative simply means that it has got a thin cell wall. That cell wall contains proteins, or what we call the peptides. I'm trying to put it in a simpler way or in a simpler form that can be digested by every person listening. This cell wall surrounds the cell. Then there is an extra outer membrane apart from that cell wall that contains lipids. Lipids are fats. So you can imagine how hard it is to penetrate through the bacterium that causes syphilis. How? If you take in antibiotics or the medication that is supposed to treat this particular Treponema pallidum, it has to destroy the extra outer membrane that contains lipids. Then it enters now the cell wall, the inner one. So that is very difficult, and that is why we call this a gram-negative bacteria. However, a gram-positive bacteria has got the cell wall without that extra layer. That is why sometimes we usually say it is better for us to tread carefully, so that instead of getting a gram-negative bacterial infection, we'd rather get a gram-positive bacterial infection. But that is so ridiculous, because you can't choose what you are going to get. Anytime you are having an intercourse, you are risking, and you can't choose or select the bacteria that you are going to have, as long as it is unprotected intercourse. So that makes it very difficult to treat syphilis. The shape of syphilis, the treponema, the shape of that bacteria that causes syphilis, that bacteria called Treponema pallidum, is spiral shaped. So that does not play really a significant role here, but we just need to know the shape because we are talking about syphilis. It is important to know that any sexual contact can transmit Treponema pallidum, be it the vaginal, the oral, anal, and unfortunately even wounds. If two people have wounds and the wounds get into contact, you will get it. Mother to child transmission during pregnancy. is also another way of transmitting this. So be careful. You don't just touch any wound anyhow, because you could be touching a wound and it is a wound that has Treponema pallidum. Then you carry the syphilis, and people may think, it is an STI, you were infected sexually, yet it was just contact of the lesions, or what we call the wounds. Now, this syphilis, as we have said, I want us to note something here. As soon as that Treponema pallidum enters the body, it rapidly spreads in the blood. The moment it spreads in the blood, it attacks another system within the body called the lymphatic system. So I know that is a little bit complicated, but I'm trying to explain how syphilis enters. So the moment it gets into your bloodstream, it then binds the cells. We have cells in the blood vessels called the endothelial cells. It binds to the endothelial cells. The next thing that happens, it causes what we call inflammation of those particular cells. If it causes the inflammation of those particular cells, it affects the vessels that are supplying the nerves. Thus, the nerves do not get enough blood supply and the nerves die. Please note that the nerves die. Once Treponema pallidum enters the blood vessels, and these blood vessels also supply the nerves with blood. So when inflammation takes place, then it stops the nerve vessels, the blood vessels, from supplying enough blood to the nerves. Then what happens if the nerves do not get enough blood? The nerves die. So nerves are responsible for pain. So when your nerves are active, you will always have pain receptors. When you are touched, you will feel. You will never feel when you are touched, when you are paralyzed, because the nerves are dead. So this means that the wounds that you may experience when you have syphilis, those wounds will be painless. And that brings us to the stages of syphilis. Syphilis has got 4 stages, and I'll run through them so quick. We have the first stage known as the primary stage. Now, during the primary stage, it is between it goes from, of course, the day when you get syphilis all through to 3 to 6 weeks. But you will realize that one symptom you will experience will be sores that are painless, what we call the chancres. Now, if you have a sore that is painless, always know that the painlessness is because the nerves are dead. The nerves have been killed by the Treponema pallidum because they are not getting enough supply of blood and nutrients. So chancres are raised papules. They are sores within your genitals. You can always see them within your genitals. If it is through the mouth, they will always appear on the mouth, where that particular Treponema pallidum entered your body through. If it is through the genitals, you will see chancres within the genitals. If it is the mouth, you will see the mouth, because we said it can also be spread through oral sex and even through anal sex. Then the stage 2 is what you call the secondary stage. The secondary stage, I would say, is highly contagious. It is between the 8th week all through to the 12th week, and you will see a rash. A rash will appear on your palms and on your sole. So when you realize there's a rash or rashes on your palm and on your sole, on your palm is inside your hand and on the sole is under your foot, that is stage 2. Now stage 3 is a latent stage. That stage does not have symptoms. And let me tell you something. That stage that does not have symptoms simply means there are a lot of things happening underground. A lot of things are happening before. Because when you move from that stage to the next stage, it's like a full-blown. Everything goes south. Everything goes south. So during latent stage, nothing may happen, but if you do a test, you will get that you are syphilis positive. And we are going to look at the tests. Then we go to the last stage known as the tertiary stage. Now this stage is a very serious one. You will experience the damage of the brain. The brain will be interfered with. It is, when the brain is interfered with, the brain is the mother of the central nervous system. So the brain controls a lot of things. In fact, virtually everything. The central nervous system controls every happenings and occurrences in the body. So for you to see, a nerve impulse has to be sent. In other words, a signal has to be sent from your sensory organ to the brain, then back to the effector organ, so that I can easily see. So if the brain is attacked, you will now begin to gradually get blind. It happens here. Difficulty in coordination of muscle movements. So you will not be in a position to move properly. You will always experience a lot of deformations. Your nose can get deformed. And remember, the tertiary stage can go from 10 to 30 years. There are people who stay with syphilis for even 30 years without knowing they have syphilis. They are treating some other ailments. In fact, a lot of them treat even malaria. Yeah, every symptom, every little symptom is always malaria. Every little symptom, malaria. Not knowing that you could be having syphilis that was just at a latent stage and it is now full-blown, and you are treating a wrong ailment. And it also affects, this tertiary stage has a lot of effects on the heart and the blood vessels as well. The whole of your nervous system becomes a very big blow. So these are the major stages of syphilis, and we really need to be careful. Now, this syphilis, if a pregnant woman, has syphilis, the pregnant woman can always transmit it to the child during delivery. That is called intrauterine transmission, or what we call generally congenital syphilis. If this syphilis, the mother who is pregnant has had it for less than 2 years, it will be a little bit easier to treat the child. But if the mother has had it for more than 2 years, then it will affect the dental features of the child. The child will experience what we call the dental abnormalities. So the formation of the teeth will become an issue, and it can lead to what we call sensorineural deafness. So, syphilis is not a disease to play around with. Just apart from sexual transmission, it can be transmitted from mother to the fetus, mother to child. So, how do you test? How do you know that I have syphilis? Just from those symptoms. And remember, syphilis is always a disease whose symptoms resemble many other. So that we are not supposed to just think that because we have these symptoms, we have syphilis. And if you go and get tested for other diseases and you realize you are not getting a positive results for them, then always go for syphilis tests. Which tests do we have? We have screening tests. Now, screening tests is what we call non-treponema. Now, we have two screening tests. We have what we call RPR and we have what we call VOL. VOL is VORL. Now, RPR stands for rapid plasma region. These ones, the two, and VORL stands for Venereal Disease Research Lab. These two tests can only work best for secondary and tertiary stages. Why? Because they detect antibodies. And another thing that happens with the VORL test, because they test antibodies, you could be having antibodies in your body that are related to syphilis, yet you don't have syphilis. So when you go for a test and you are going for a VORL test, then make sure that you don't have any viral infection in the first place, because if you have a viral infection and you are and a VORL is done on you, then you will test positive even if you are negative for syphilis. Why? Because the test look for antibodies. It does not look for the disease itself. It looks for antibodies that fight a particular disease. Unfortunately, the antibodies that are elicited when you have syphilis are always the same as the antibodies that you will have when you have viral infections. That should be very clear. There are drugs again that if you use, or rather if you are using and you go for a VORL, you will test positive. So if you are using drugs like chlorpromazine, you will always test positive. If you have rheumatic fever, you will always test positive. And if you also have an autoimmune condition like lupus or maybe leprosy, you will also test positive. So screening is a first line test, but we have a confirmatory test. If you want to confirm that you have syphilis, you just don't want to think. If you want to confirm, then you do what we call a confirmatory test, or what we call a treponema test, FTA ABS. That is what will now confirm to you. Now, if the patient has tertiary syphilis and the patient develops meningitis, then it is always important to do what we call a lumbar puncture. You perform a lumbar puncture. It simply means you take from the spinal cord, you take fluid and do a test known as serology to confirm that this is syphilis, or rather tertiary syphilis, that has led to meningitis. So, in as much as this disease looks untreatable, the good news is it is treatable. It can be cured. What are the curative medicines or antibiotics for this? The drug of choice for treponema pallidum or syphilis has always been penicillin. Penicillin injection, that is intramuscular injection, has always been the most favorite medicine or drug of choice for syphilis. So the dosage, if you are suffering primary, secondary, and probably early latent means you have had the symptoms for not more than 1 year. So a single dose of benzathine penicillin will work. But again, there are people who are allergic to to penicillin. If you are allergic to penicillin, you would have doxycycline or even ceftriaxone. That will work for you. You will always get for penicillin, you'll always get 2.6 million units, and the dose is just an injection. But if you have late latent to tertiary, that means more than 1 year to an unknown period of time, you have suffered for so long, then an IM, an intramuscular, that medicine injection between your muscles, inside your muscles, you would have an IM injection of the same penicillin G, benzathine penicillin G, but you'll have it for 3 weeks. That injection for 3 weeks at a higher dose of probably around 10 million units. Therefore, syphilis is a sexually transmitted infection. Moreover, it can be transmitted through contact, especially if you have wounds. Taking good care of ourselves is very important. People who have young kids and are fond of kissing the kids in the mouth, if it so happens that you have a wound, some wound or ulcers in your mouth, and probably this ulcers is due to syphilis or Treponema pallidum, and you kiss the child and the child gets into contact with that particular wound, then you'll be endangering that child's life, owing to the fact that a child's immunity is never as strong as an adult's immunity. So as the child is still younger, there are processes in the body that are taking place so that the child attains full immunity as time progresses. That is all we had today as KAREEM'S Clinic. Thank you for listening, and if you find this episode of ours useful, kindly consider subscribing. I would thank you so much if we grow the channel.